afternoon, good evening to most of you coming from Australia. It's such a good day to speak to you because we're having what we call a small group discussion, which is when we all come together as a community to discuss an issue of interest to us as a community and to share some learnings and challenges along the way. Today's discussion is co-hosted by RDI, so Rare Diseases International, along with RVA, Rare Voices Australia. We're going to be led this afternoon by Nicole, so Rare Voices Australia CEO, which is the peak advocacy body advocating at the national level for persons living with a rare disease in Australia, but really a member and a really close friend of RDI. The RDI member-led series really encourages patient advocates to share challenges, share learnings, and really ask questions and have conversations with each other on issues that most of us are dealing with simultaneously. Today's discussion will be on Australia's national framework for rare diseases. We will discuss how RVA was able to lead this incredible milestone, some challenges along the way, some lessons learned, and we'll also discuss questions around implementation and putting the plan to action, which we all know is the next step. This is an open discussion, so please feel free to enter any questions in the chat as we go. Nicole and her team will be really happy to take those on. Also, you could use the raise your hand function right at the bottom of your so Nicole, I will let you take the floor. If anything is happening technically, please let me know because I will also be your technical host. Thank you.
Great, thank you and welcome everybody. It is actually evening where I'm at, so I'd be really happy if today's session was really informal, and I welcome lots of questions and queries, and certainly I don't know that I'm an expert in anything to do with national plans, but I can certainly talk to you about our experience, and it'll be interesting to see how, I guess, whether there's some learnings that can be shared or some useful things that we learned and some challenges we faced and also some surprises, I think, that we can share. And hopefully that will help. But look, as I said, I'm a very informal person, so very happy just to have a chat tonight. So I thought maybe I'd just start very briefly introducing, I guess, myself and my connection to rare disease, and a little bit about Rare Voices Australia before we then talk about the action plan. So I'm a rare disease mum. I have a 21-year-old son now with a rare disease, with MPS. And so, like many of you, I'm sure, on the call, I started off in my advocacy in rare disease as a mum. I then became, and actually my probably first big advocacy achievement was for advocating for access to his treatment. So, and then as many of you, I'm sure, then started becoming involved with the organisations, and I've been with Rare Voices Australia now for 6 years, and the Rare Voices Australia, our goal always has been around policy for the organisation, and it actually came out of a conference where it was realised that the rare disease sector in Australia needed to work more collaboratively and together and really focus on policy. So the reason Rare Voices Australia really came together was to work towards getting a national rare disease plan. So we actually it's been quite a big journey for RVA to get to our national action plan, and I thought it might be a good idea. I've got some slides and I can show you a little bit about the action plan and what's in it, and see what it is. So if I'm clever, I'll work out how to share my screen. Oops. Is that coming up there?
Oh, yes,
Okay,
that's perfect.
that's there. Okay, so the National Strategic Action Plan for Rare Diseases in Australia is the Australian government policy position on rare diseases that informs all of RVA's advocacy, and we encourage all the rest of the rare disease sector to use the plan as well. Hopefully you can just see there on the plan that I'm holding, you can see a logo, and that's actually the Australian government's logo, which is really important. I remember at the time it felt like that RVA was doing all the work. So there were some that said, well, it should have Rare Voices logo on it, not the Australian government, but it's been a lot more strategic to have the Australian government's logo. The plan is quite broad in its scope, but it is based around 3 pillars: awareness and education, care and support, and research and data. And when we were putting the plan together, it had much more complicated names originally, but we got really strong feedback from our consultations and from our steering committee around the need to have really clear language that everybody could understand, clear and simple language. So that's how those pillars came about. And what the action plan does is provide a framework and a policy direction from which the whole rare disease sector can advocate on. And it's given us a language, almost a shared language, that we can position any specific rare disease issue within that framework, and it helps give everyone a shared language to talk to politicians and policymakers and government on. So here are the 3 pillars. This is a bit of a summary of the pillars. You'll see that there's priorities under each pillar. And in the full action plan, there's also some implementation steps underneath those priorities. And often those implementation steps are around perhaps the next steps or the first steps that were identified as part of the consultation. I should probably talk a bit more about the consultations. So when we were developing this action plan, we very much wanted it to be a plan that is developed by the sector and for the sector. We did a number of stakeholder consultations. We went all around the country and had sessions with bringing together patient group leaders, clinicians, researchers, and departments as well, departments of health and government where we could. We also did a survey, and we also had some more targeted focus groups. So for instance, we had a targeted focus group with our roundtable of companies to get the industry point of view as well. And that whole consultation process was really important because it gave us a lot of confidence to know that the content that was in there really did have the support of the sector. And this is my last slide because I do want to allow a lot of time for questions and discussion. But this slide, I also wanted to give a sense that, I guess, of the time it takes and the steps along the way certainly in Australia, for us to get the action plan. Rare Voices Australia is 10 years this year, actually. And so we've got the timeline here, and you can see that Rare Voices Australia came together following a symposium, as I've said, out of a recognition that we needed to work together better. We then, RVA went on a roadshow and talked to people living with a rare disease, to doctors and researchers, to get a real sense of highlighting the challenges in Australia with rare disease. And it was out of that early work where we started then to document those findings, and formed a work around what we called a communique. So we then went out to organisations, or the RVA went out to organisations and got a lot of support around this communique, and that led to a national conference. So our early stages as an organisation was really about collecting data and collecting evidence around the challenges of the rare disease challenges in Australia. When I joined RVA in 2016, what I discovered is that RVA had done quite a good job in starting to familiarise our government or our parliamentarians about rare disease, and they'd started doing things like different events at Parliament House. But when I spoke to the parliamentarians, they said that they had lots of sympathy about rare disease, but that they thought it was all very hard, and they thought rare disease policy was hard, and they weren't quite sure how to approach it. So when I came to RVA, we started to change our tack a little bit, and we started to try and make rare disease policy not as difficult. And it was really important to break it down and to really look out for those little wins, and create traction as we went, because we needed to make rare disease policy not as overwhelming for policymakers. And I think that was really the start, I think, of turning things around. And as the policymakers also became confident in regards to rare diseases, they then, over time and through with us continuing fostering that relationship, they then came to the point where they thought, well, okay, yes, we can do. They were starting to see the benefits of when they had done little wins, and then started to see the value of putting together a more comprehensive plan. So that's sort of how we came about in terms of getting government support to develop a plan. So I might pause there and stop sharing and take some questions. Or did anyone have any comments at that? Oh, yes, there's questions already. Okay. All right.
Nicole,
So
what I've noticed is that people are joining from really around the world today. We have Namibia, Lesotho, Hungary, Romania, just to keep that in mind, that it's such a great sign.
Yeah, that's fantastic. So there's a question here. What would be the most important policy goals or changes in Australia from the patient's perspective? So look, certainly from the patient's perspective, what I think surprised us when we went around to the different parts of Australia and did our consultation was there was actually quite a lot. There was a lot of commonalities, and really at the heart of a lot of people and a lot of groups. Look, I think certainly, the policy goals around diagnosis, policy goals around treatment and care, but also what came through from the consultations was that it wasn't just about treatment, but care was really important. So whether that's and the type of care, and being able to get all the types of care that people needed. So not just health, but the gaps in disability and mental health and wellbeing care and psychosocial care was also highlighted. I think the other big one, of course, was data and research. What we realised that we had to do as part of this stakeholder consultation, and also as part of this, as well as the consultation, we also collected evidence. We did literature search, and so there was a real focus on data and an evidence base to it. But what we realised really quickly was that as we went along, it wasn't enough just to look at data or evidence, but we had to highlight the gaps. And that was really important in the rare disease sector. I think probably, I always say that I think the gaps are just as important as the data and the evidence. So that was also one of the things that we tried to build into the finished action plan, is to really set, before each section in the action plan, we had a why is this important section, which gave a real context around some of those rare diseases, I guess the strengths, but also really highlighting those gaps as well. So yeah, look, in terms of the most important policy goals, certainly the pillars, the awareness and education, care and support, and research and data. And that was also why we made them pillars, because they were really important. Okay, did anyone have any other questions? It's wonderful to see so many people on. One of the things that happened when we launched the action plan was, I think I didn't, we actually got some constructive feedback. We got, some people said to me, it's too broad and it's too comprehensive, and perhaps you should have just have put in a list of 10 things, just so that governments and can get through. And I think we were a bit wary of doing that. We really wanted this plan to stand the test of time. We didn't want it to be a quick sort of tick the box. We were also a bit worried if we did sort of come down to 10 things, what about all the other things that were missed, and how we didn't feel comfortable about missing too much out. Was also a bit worried that if we did make a sort of a short list and that government sort of ticked it off, they would have felt that they'd finished with rare disease, and we wanted it to be an ongoing process, and we wanted it to be, I mean, as we all know, rare disease is quite complex, and, you know, so it's not an easy fix. So we wanted to do that. And I think the other thing that we were mindful of too is the importance of making, just as we say that it was developed by the sector for the sector, since the launch, we've also said that implementation is the responsibility of the whole sector. So not just government, but everyone can contribute to that, the implementation of the action plan. And that, I think, helps to future-proof it a bit. It helps protect it from, if the government doesn't, you know, finds another priority or slows down, it can still be progressed through the rest of the sector. And I think that's been really important. Also, because in Australia, our health system is governed by both Commonwealth and state and territory. So we actually need a lot of different, there's a lot of different partners, I guess, in it that need to, that have responsibility. So it's been quite useful, I think, and quite effective to highlight that everybody has a responsibility to implement it.
Nicole, I do have a question for the group, just recognizing a few faces in the audience. I would like to ask anyone in the group if they're currently starting their advocacy for a national plan, and maybe some of the challenges they're starting to confront even at this early stage. I don't want to put anyone on the spotlight, but I think Christine, Trudy, I have an idea that you may be in this early process. Please feel free to free your mic and share with us.
Okay, let me start. Both Roslyn and I are from Rare Disorders Kenya, and we started it just not so long ago as an organization. And we have the government now on board in the sense that they are acknowledging that rare disorders do exist in the country, and the work we've done as RDK in creating awareness and advocating for rare diseases. So that's a huge plus for us. And also there's a technical working group that was formed December last year for rare disorders by the Ministry of Health. So that's a huge sign again for us. And then recently in May, we had a stakeholder meeting for rare disorders, the first stakeholder meeting for rare diseases in the country. So we are hoping with all this that we'll actually start the ball rolling for a national plan. And I think maybe that's why both Rose and I are here, just to try and get hints on what else are we missing, what do we need to add. As you're saying, you can't just have like a list and then you don't exhaust it, because it's a purpose, right? And then, I don't know, it's, for us, we are happy that the government has recognized us and the work we've done, and that we are now partners and not trying to compete or break down barriers just to get a hold of them. I don't know if I've omitted anything else, Rosalind. I'm putting her on the spot as well.
Look, that sounds great. Certainly from our perspective, from our experience, it was one of the most important things was to create momentum and also to build relationships with governments, and also to build relationships, but then keep fostering those relationships. It's really important for the government to feel confident in the peak body, to feel like that that the peak body is credible, that they can have some wins with the peak body, and that the peak body can actually help government. I think that's really important. So some of those activities that you've talked about will really help demonstrate that, and really get that, really get that going. I think for us, when we first sort of started talking about government, and they said, yes, we're sympathetic, but, and they said really clearly that rare disease policy they felt was too hard. We then sort of broke it up into different sections, and we really started to work with government on the areas that they were interested first. So in Australia, earlier on there was a greater interest in things like treatment. They weren't so interested in things like registries, but certainly treatment and awareness they felt much more excited about. So we just started there. So even though for us we might have had greater priorities, it was really important to start where they were. And it meant then as we made progress together, they could see that, and they thought, oh, actually maybe, rare disease policy isn't that hard. The other thing that helped us too was to help government to recognise what was a rare disease issue. So, for instance, the Australian government had actually invested a lot in genomics, but they didn't necessarily see that as a rare disease issue. Or they had done some investment into research or clinical trials, and again, didn't necessarily see that as a rare disease issue. So look at the work that your government is already doing. And if it is something that is related to rare disease, tell them it's related to rare disease and say, this is great, because governments, I think if they feel like they've got some strengths or they're doing well, they're more likely to then do more. But particularly in rare disease, often they are doing patches of really good work, but they just haven't recognised them as a rare disease, so or relating to rare disease. So you can help sort of bring them together. And it was when we started to do that they realised, well, actually, we're already doing some of this work, and if we had an overarching policy, we could get more. We could get even a greater outcome, and they would get more impact for what they were doing. And Trudy, you had your hand up?
Yes, thank you, Nicole. Congratulations, you are now 10 years I think we are probably less than a year old. And I hope when we are 10, we'll be like you. You obviously have your programs in place. What I would like to share is that when we started in the rare disease space, we were daunted by the thought of approaching government. It seems too enormous and too difficult. And so we just approached patients, we just worked with the patients at a local level, grassroots level. But what then happened is we had that realization that we would not go far if we did not work with the government. And we then approached government early this year. And when we did approach them, I say to them, we are thinking of having a rare disease alliance. And they said, we have a rare disease alliance. You are going to represent us. You've just come in and we want you to take this through. So it looks like they were waiting for somebody to come in and coordinate the work that they are already doing. Because we do have a number of disease-specific rare diseases that have MOUs with the ministry and are working as individual entities. And because there are so many rare diseases, I think they were also worried about how they would coordinate this population group under the non-communicable department. So I was amazed at how they wanted us to go through with it. And I'm still daunted, though, at how we are going to come up with a policy to represent rare disease space in our country. But I think the first step is really very important, and I think that's what we've just made. Thank you.
Yeah, well done. It can be daunting, can't it, to go and sort of put yourself in front there. Certainly, we've had a lot of feedback from the Australian government that they much prefer just to work with one peak body, that it's a lot easier for them, I think, to have to deal mainly with one peak body. And I guess that you can understand that why. I mean, they otherwise they have lots of different groups coming to them with lots of different messaging. So they've always been really clear, and not just to us, but to the whole sector, how important it is for the whole community to organise and give them really clear messages, and that makes it easier for them to help. But to do that, you also have to maintain those connections with your on the ground and communities, because how else can you stay representative? And you need to, and that's not an easy thing to do, but that's something that RVA has to continue to work at. So we have at the heart of our organisation, we have what we call RVA partnerships. So we partner with over 100 different specific rare disease groups, and so there's lots of diversity, lots of different priorities, and it was actually the action, and so that is really challenging. And actually, since we did the process of going through the action plan, that's actually helped with that, because we all have a bit of a starting point and language and things that we can go back to, particularly when there's differences, to say, well, this is sort of our shared common goal, and it helps us not get lost in that diversity, and we can sort of keep to that. It also helps to it helps RVA, I guess, to keep clear about what it is that we do, and it also allows the individual groups, if they want to do if they want to do advocacy either outside or a little bit different to the action plan, then that's okay. That's okay too. But there is real power for them when they're advocating for their specific issues. If they can locate it within the framework, when they go to parliamentarians, they can say, this is our issue, this is what we need, and this is how it's aligned to the action plan. And often what we found is that government may not have heard of a specific rare disease group. They may not have heard, so they may not know the people that come and see them, but if they do know of RVA and they do know of the action plan. So it just helps get that sense of familiarity around. And I guess the other thing I wanted to say around how daunting it is with to create a national plan, I know it is really, really daunting. And I don't think we felt like we knew how to do it when we started. But the thing to remember, and the thing that we used too, was there's lots of other countries with national plans. So there are other models you can look at, and then just pick the ones that you think fit right for your country.
Actually, Nicole, I have a question for you that I've gotten from a lot of our members, and I was hoping you'd have some insight. Is that many of them encounter some, I don't know what the competition is the right word, but a little bit of tension with the disability movement. I know I've heard this in New Zealand and a lot of other countries, in Singapore, where they've had to say, often we like to say we collaborate with the disability movement, and our movement in general is very collaborative. But when it comes to advocacy, we're finding more and more that the government thinks that we're already covered there. Did you face this problem, or do you have any insight on it?
We did face problems with disability. I don't know if it was the same type of problems. Probably in Australia, our biggest problem was that we didn't have any, there was a real lack of evidence or data on rare disease and disability, and that became really evident really early on in the action plan process, the action plan development process. And actually what we did in that case was, when we recognised that, we actually have to create some evidence on that. And we actually, sort of as a side project to the action plan development, were able to get to do some specific research around disability and rare disease, just to generate that data and that evidence, so that we could then use that to inform the action plan. And I think that was it was really, it really highlighted the importance of, as we went as we went through the process of developing the action plan, we really had to be sensitive to gaps and then look at ways to fill those gaps really, really quickly. In terms of the other parts of your question, I think we're, I guess, always mindful to stick to, I guess, the specific inherent features around rare disease and the specific nuance features around disability, because I think, and so that what the work that we would do in the disability space is sort of complementary to other work that is being done, but really has that, what makes rare disease specific, that's really at the core. But there is a bit of navigating, and certainly it's not just about the content, but in Australia, and I don't know if this is the same in other countries, but sometimes the way in which organisations advocate are very different. And in Australia, sometimes the way disability as a sector advocates is probably a lot more louder and a lot more critical than what works for us in the rare disease sector. So we sort of navigate that quite carefully, and make sure that we don't get, or the rare disease voice doesn't get lost within that bigger and louder and often in Australia anyway, louder voice.
Thank you. I see we received quite a few questions from, I think it's Liron, if I'm pronouncing it correctly, from Israel. Liron, if you're comfortable, maybe you could free your mic. No. Okay. Well, either way, it was really
Hi,
nice.
yes,
Yep. There
sorry,
you go.
I'm here, yeah. So I just wanted to know if the family doctors in Australia, if they are obligated to report about a rare disease.
No, they're not. No. No, and that's one of the...
So you are, sorry, so you are not centralized all the records for the rare diseases in one place?
No, we're not. And so certainly that's why I think data and research is really, all that data collection is really important in Australia. Our health system and the information and patient care is very fragmented. So yes, that's certainly a big issue in Australia, and also it's fragmented in Australia's geography. Population is quite dispersed across the country, so it is really quite an issue. Probably a big priority for Australia is around setting up centres of excellence and trying to get some accumulation of knowledge. One of the things that we also put in our action plan, as well as the pillars and priorities and implementation, we also had a section focused on what we called implementation mechanisms, and those vehicles that will help drive change. And certainly those things like centres of excellence were a big driver. We put up as part of the action plan as a big driver for that. And I think probably the other part, which I haven't talked about too much, but is probably so important, is now sort of the implementation phase. So we are advocating, RVA has taken on the role to advocate for the full implementation of that action plan. And you know, I suspect that will take some time. And you know, when we looked at the action plan, there were some areas where we thought that RVA had specific expertise to actually lead that work. So things around, you know, the consumer part of it in particular. But there were also some areas in the action plan that we didn't necessarily think we had specific expertise, but we were worried if we didn't at least start doing the next steps that maybe no one else will. So we've started to do some reports on areas such as workforce and also registries. And as I said, we don't have the expertise to do all of that work, but the aim is really about starting progress and to keeping that traction going and then getting us to the next step. So having a plan has been really important, but if we don't continue to fight and work towards implementation, it's really just a book, isn't it, in the bookshelf. So it's not a magic bullet. It's been really, really valuable, but there's still much work to be done.
Mm-hmm. Okay, thank you. And in the same issue, I wanted to know if the health fund in your country, if the hospital, does they budget according to the number of patients with rare diseases that they treat?
Yeah. So the tricky thing in Australia is that they do develop budgets around what they call activity.
Mm-hmm.
And activity-based funding, but they don't do a very good job yet at measuring or counting rare disease patients. So they're not patients in Australia might be measured in terms of whichever clinic that they're at. So they might be measured as a heart patient or a lung patient, but at the moment they're not routinely categorized as a rare disease patient. So that's certainly a huge systemic issue in Australia, and again, I guess why we were really keen for, I guess why we're not surprised that data collection was really one of those big pillars.
Mm-hmm. Okay, thank you.
One of the, I think the surprising things that we found with the action plan was that as I said, RVA did, you know, we did the consultation and the work, and wrote the plan, informed by what we heard from the sector. But it was technically an Australian government document with that logo. And as I said at the time, we thought, gosh, you know, we did all the work and they get the they get the credit. But it has been the most powerful thing, because what we're seeing now is that the action plan as government policy is now starting to inform other government policy. So, for instance, at the moment, Australia is going through a review of their national medicines policy, and as the drafts are being developed, one of the things that have been included in that is really clear alignment, and it highlights. It said this is, you know, this national medicines policy is being written in alignment with the National Strategic Action Plan for Rare Diseases. So it's actually really it's really powerful in Australia in terms of the government. Whenever a government does any new policy, they look at other government policies. So it's been a really useful way to influence. And I'm not doing a very good job of checking the questions. But
No, that's fine. I see Laura's raised her hand.
Yes, no worries, Nicole, and thank you so much for all this information. I'm actually learning a lot on this session, and I had a question based on what you just say. So, for like an action plan, you have to get a lot of supports, and I was wondering if you get also international support. You know, like as it is only an action plan only for benefits from people suffering from a rare disease in Australia. Did you manage, or was it even useful to get some help from international organization or politics from other country or abroad?
Look, we certainly very much looked at other national plans, and we went through a lot of different plans and then looked at what we thought was most appropriate for Australia, and certainly used them as a starting point for them when we did our consultation process, and that was really useful. Also, the process of that helps to highlight, I think, the really strong common themes throughout, and I think that's one of the really useful things around rare disease, is that I think there are some really common themes that are really important no matter what disease or no matter what country. The other thing I think that one of the things that we were really conscious of trying to do and note within the action plan is that rare disease issues are very much interrelated. So it was really important to show how they are linked. And what we found when we talk now to the sector and to governments about implementation, that's been a real strength, because we can, any progress and implementation in any one area will have a positive impact on a whole lot of other areas. So that's a really good thing. So for instance, what I mean about that is that obviously any progress in diagnosis will have a positive impact on terms of care, the care and support. And also similarly, any progress in research will also then lead on to care and support. And so that's actually a real strength, I think. I think for rare disease, there is a real opportunity to make a big difference wherever you start. So, you know, I would always encourage you to, and certainly at RVA, we try and be fairly strategic, I guess, in where we start. And sometimes it's where there's been a bit of progress before. So if you're starting to see government taking an interest in a particular area, and then that would be a really good place to start. because that will also lead to the other areas, and it will make things a little bit easier.
Thank you, Nicole. Yeah, it's always like the difficult things to act at an international level, but also at a local level, because it's like where we can do the most. And so, yeah, it's kind of complicated to get the support from big, I don't know, I mean, maybe, you know, the WHO or others for only one country. So that was quite in my mind when you were talking. So thank you for your answer.
Just checking the...
Yeah, there is also a question from Trudy. Trudy, if you want to maybe open your mic or...
Oh, how do you keep the momentum going? What a great question. That's a question we ask ourselves all the time. And look, and also on the call is a colleague of mine, Falak. So thank you, Falak, because you're putting all the links up that I'm not putting up. Look, how do we keep the momentum going? It's something that we always are asking. So, look, in terms of government, there are some key things that we do, and in terms of the focus on keeping the momentum going. One is, I think, really putting a lot of resources and into fostering relationships with parliamentarians and with government. So we do spend a lot of time in going to see them, in having meetings. We look for excuses to go and meet them, both in terms of politicians, but also Department of Health or Disability, the Disability Agency as well. It's really important that they know you, that you go and see them face to face, that you can, and often that it's really important to see them when things are going sort of okay, like not with any big issues. Of course, you want to go and see them if there's something terrible happening, but it's also important just to go and so that they know who you are, and so that they feel comfortable with you, and that when there's an issue, they know to call you. So we certainly put in a lot of, we look for excuses to go and visit and have meetings with them, but we also have a number of formal events that we do as well regularly. So we have regular events at Parliament House where we will invite all the parliamentarians to come and meet representatives from the sector. We actually had one earlier this week, and it was the first one we've had, I guess, since COVID. So it was the first face-to-face one we've had for a while. We normally schedule them on Rare Disease Day, and so it's now become a regular event. But we also did one now because in Australia we've just had a recent election, so we've got a new government in. So the purpose of the parliamentary events is really around introducing parliamentarians to rare disease, to the sector, and to RVA as the peak body, so that they know that, and they can see that we can bring together all the different parts of the sector into this event. So it's really important to keep looking at those tangible examples of how you can bring the sector together. The other thing, I guess, that we often do to keep the momentum going is around looking at trying to address those gaps. So we'll increasingly do, we'll create a white paper or a report on a particular area. So we've done one on disability and rare diseases. We've also done one on workforce, and we focused on the metabolic workforce, just to start generating those interests. And also to give us, the good thing about making a report is it gives you something to hold, and you can go knock on the door and then go and say, look at our report, and then you can, so I'm a real big believer in generating a report or something that they can hold, and it gives you an excuse to reach out to the parliamentarians. But it does take time, but it's so important. The other thing in Australia that we've have too is we have what's called parliamentary friendship groups. So they're groups within Parliament that where members of Parliament come together on different issues. So we have a Parliamentary Friends of Australians with a rare disease, and that's really important because it's about fostering champions within Parliament, and we have one from each side of government, so they help too.
Nicole, I think there's a final question from Leron as well about the ratio between the population number and the number of certified skilled clinics. I think it's because you referred to centers of excellence as well.
Yeah. So in Australia, most of the specialist, most of the care for rare diseases or the skilled expertise would probably be perhaps one centre in each state. But each sort of specialist clinic, there might not be a specialist clinic for every rare disease in each state, and certainly that's one of the issues that we've been sort of fighting for, is that consistency across state. It's pretty sparse, but there are, and so it makes it very difficult for patients that are not in the cities and that are further out. And even where we have a tertiary centre in a hospital, they also often have workforce issues and not enough staff and those sorts of things. So certainly one of our current focus is to build up and strengthen our existing clinics, to build them up into more centres of excellence that can really then bring in the research and clinical trial part as well.
There was a really interesting comment in the comment sessions from Joanne. I think she's a member of your team or your board. She had mentioned your actual capacities as a team, because many of us work as quite small teams. And she was mentioning the use of part-time staff, consultants, strategic partners, how you were able to pull skills in. Could you maybe elaborate on that?
Yeah, sure. Joanna is our chair. Welcome, Joanna. I'm trying to find your comment to make sure I answer it properly. But look, I think someone said to me once that RVA is a small organisation that works like they're big, or that pretends that they're big. So I think, and look, I think that's really important. So although we have a relatively small staff team, we do have a really strong and active scientific medical advisory committee. We also, as I said earlier, we also have over 100 rare disease partner organisations. We also have a round table of companies. And so what's been really important to build the capacity of RVA has been to focus on those partnerships, because there's a lot of goodwill, and there's a lot of I think shared purpose within the rare disease sector. So although we might have a very small staff team, our concept of what the RVA team is much broader. So we have a volunteer board of directors and our scientific medical advisory committee. And so when you start looking at the team more broadly, it really helps to build that capacity. So like, do use your networks and do look at ways that you can sort of formally bring them into your organisation as well, because it just helps sort of strengthen strengthen that. We also, as Joanna has said, sometimes, particularly with those white papers or reports, we will look at getting external research consultants in, and we work very closely to them. And actually, a lot of what Philip does, who's on the call, is work with researchers and around research partnerships. So it's really important that we make sure that the RVA, or the rare disease perspective, is really strong in there. But certainly, since we've really embraced that, I think partnership is really central to what we do. So, and it's helped us sort of not get too daunted by the fact that if we are small, because you might be small, but you might have really strong connections, and if you can bring them in, it just makes it makes what you can do so much more.
Thank you. I was wondering if anyone has any final questions before we close the discussion. I will definitely email all the registrants, so if something comes to mind when you're home, feel free to also ask Nicole, our resident expert in national plans. Thank you so much,
I don't
Nicole.
know that I'm an expert, but, look, I will say too, also the other thing that we did before the action plan was that we reached out to other, we looked at other rare disease plan, but we also looked at other action plans with other disease areas. And so look, just we asked lots of questions, and people are generally really, really generous. So keep asking, and don't be afraid to work it out as you go along a bit too, because it's all very new. A lot of what we do in the rare disease sector, and we talk about this a lot at RVA, that often we're doing things without much of a guidebook. We're doing things that people haven't done before. So it's really important to, I think, be really clear about what sort of organisation you are and what your goals are and those sort of core values, because you are going to have to find your way a bit, and it's we sort of learn as we go, and it's a very iterative process, and that's okay as long as you make sure that you are constantly checking in with each other. And I think that's something that we really value at RVA, that we use each other's strengths and expertise and really check in a lot with each other around, is this the right direction, or is this the most strategic direction? Is there another way to do it that perhaps would get further? So, don't get daunted. All the good things that have come out in the rare disease space is people haven't done before. That's the whole thing about rare disease, isn't it? I think it's the only sector where you're both the beginner and the expert of something at the same time. Remember when you were diagnosed and you felt like you didn't know anything, but then you had doctors asking you about the disease. So I think there's that juxtaposition that we're really good. We're in the rare disease sector, we're really quite good at managing that. So be both the beginner and the expert at the same time.
Well, I really love that, this be the beginner and the expert at the same time, because essentially as patient advocates, that's what a lot of us have had to do, and a lot of the organizations that form RVA and RDI have had to do as well. I'd like to thank you so much, Nicole, and Felek as well, for putting in those links and answering questions, and Joanne and the rest of your team for volunteering to have this discussion with us. And also thank everyone for joining us this afternoon. It's just been such an open conversation. I felt I've learned tons. I know, Laura, you have as well. So Nicole, I'll let you end the call and have the last word though.
Look, I just wanted to say thank you. I think I was a bit embarrassed when RDI first asked me, because I thought I don't think I'm an expert. And look, I think just it's really important that everyone I think trust their own strengths and trust their own understanding of their communities and their governments, and have a bit of courage and listen and learn as you go along. And my door is certainly very open. RVA, very happy to share what we've learned and to share from others. So you're not alone, even though I know it feels like often that we are. So thank you very much for the opportunity.
Great. Thanks everyone. Thanks for joining us. Bye.
Thanks. Bye.